My name is Anisha Hodges, and this is my head to toe assessment. Here's my card. We're going to get started. So, hi, my name is Anisha. Could I please get your name and your date of birth?
Azaria Martin, 12/24, 1996.
Thank you so much, Miss Martin. I want to check this. And do you have any allergies?
No, I do not.
All right. And how are you feeling today?
I feel pretty good.
That's good. Do you know where you are?
The West Coast University Hospital.
And the date, the year we're in?
It is 2021.
And the president?
It is Mr. Beck.
All right. President is, patient is alert and oriented times 4. All right, Mrs. Zara, how are you feeling today?
I feel good.
That's pretty good. On a scale of 0 to 10, 0 being no pain, 10 being the worst pain ever, how would you rate your pain?
0.
All right. So, your vitals have already been taken by the previous nurse. I did assess your gait when you walked in. So we're going to start with our head to toe assessment. We're going to start with your cranial nerves. So, could you close one nostril? Could you smell this?
Vanilla.
All right. And close the other nostril. And what does it smell like?
Coffee.
All right, thank you. Patient cranial nerve 1 is intact. Now I'm going to test cranial nerve 2, which is your perilous. So, convolution. All right, could you follow this, please? All right, pupils equal reactive to light. Perilous there. Your Snellen chart has already been completed by the previous nurse. You do have 20/20 vision, which means you can see pretty good. Now I'm going to assess cranial nerve 3, 4, and 6. Excuse me. Alright, cranial nerve 3, 4, and 6 is intact. Now I'm going to take my cotton wisp or something pointy. I don't have my cotton wisp, so something pointy. And test the facial nerve, cranial nerve number 5. Alright, could you close your eyes? Do you feel it?
Yes.
Alright, do you feel it?
Yes.
Alright, now I'm also going to test GTMJ. Could you open and close your mouth, please? Alright, no clicking with the TMJ. Now could you smile for me? Could you show me your teeth? Could you puff out your cheeks? Could you raise your eyebrows? Alright, that's cranial nerve number 7. Could you close this ear for me? Could you close the ear on the left side?
ABC. One, two, three.
Alright, thank you. Now that's assessing all cranial nerve number 8. Now I also have to do the Romberg's test. Do you mind standing up for me? Alright, so I'm going to have the patient close their eyes with their feet shoulder length apart. And just close your eyes for me. Alright, we have a negative Romberg test. That's cranial nerve number 8. Could you say ah for, could you stay standing for me? Could you say ah? Alright, gag reflex is intact. Mouth is moist. Y'all, I can see her mouth even though she got her mask. Mouth is moist. Are these your teeth?
Yes.
Tonsil is +1. Gag reflex plantar. Uvula is in midline. Could you turn around for me? Alright, trachea is in midline. No thyroid problems. Everything looks normal. Could you shrug your shoulders for me? Alright, could you shrug against resistance? Could you turn your head to the right? Turn your head to the left. Cranial nerve 10, 11, 12 have been assessed. Now, you can sit back down now. Now I'm going to look at your ears, pulling up and back. TMJ is intact. It looks shiny and pearly gray. Alright, ears are intact. Everything looks shiny gray. Temporal membrane. Alright. Now, I already checked your ears. I checked your mouth. Gonna feel your head. No lesions, no mark. Everything looks normal with your head. Now I'm gonna check your neck. Everything is midline. Could you please swallow this water for me? Alright, patient can swallow. The thoracic cavity and the thyroid have already been checked. Midline is intact. Now I'm going to check the patient's carotid. Listening, auscultating the carotid. Auscultating the carotid. Comparing the carotid to the apical. Could you lean forward for me? Alright, everything is equal. Now I'm going to check the patient's JVD. T, turn that way. Alright. No signs of jugular vein distension. No signs of jugular vein distension. Now, I'm also going to check your lymph nodes, starting with the preauricular, postauricular, occipital, posterior cervical, posterior cervical, anterior cervical, tonsillar, submandibular, submental. Could you lift your shoulders up for me? All right, put your shoulders down. Supraclavicle. That's the patient's lymph nodes. Now I'm going to do the chest area. Listen to the APETM. So starting at the sternum to the right is apical. All right, listening to the Erb's point, tricuspid, and mitral. This is also where I listen to the apical, but I've already listened to the patient's apical pulse. And I'm going to look at the skin. Skin is warm, looks warm, no signs of edema. Everything is normal. Testing for turgor. Everything looks normal. I'm going to look at the patient's thoracic cavity as they breathe. Everything looks normal. No problems. The patient has no labored breathing. Everything is normal. Lung sounds. Could you sit up for me, please? I'm going to look at the patients at different 8 points. So I'm going to 1, 2, 3, 4, 5, 6, 7, 8. All right. I'm going to listen to the patient's back. So here, I'm going to do 1, 2, 3, 4, 5, 6, 7, 8. Listening to the patient's lung side. I'm going to do laterally. 3 on this side. 1, 2, 3, and then 2 on this side. 1, 2. All right. Could you stay standing for me? I'm going to look at the respiratory expansion of the patient's back. All right. Everything is normal. No signs of pneumothorax, anything going on. Now I'm going to look at the patient's arm. You can sit down for me, ma'am. Could you please grab my arm? Could you please grab my hand? Testing the patient's arm strength. Arms look nice and bilateral. Now I'm going to do your bilateral pulses, brachial pulses, and radial pulses. Everything looks nice and normal. I'm going to, could you put your arms in front of you? Thank you. Could you put your arms beside you? Put your arms down. Put your arms all the way up. All right. Thank you very much. Now I'm going to test the patient's tricuspid brachial. All right. Put the blunt in. Now here. All right. Now here. Let's see on the other side. Here. All right. Now I'm going to test the patient's capillary refill. Capillary refill is less than 2 seconds. Could you do this number for me? All right, thank you. Patient skin, it looks all normal. No signs of edema, no signs of pitting, no skin lesions or marks. Now, I'm going to assess the patient's abdomen. When's the last time you went to the restroom?
Last night.
And how was it?
It was good.
That's good. Was it normal for you?
Mm-hmm.
And last time you urinated?
About 20 minutes ago.
No burning when you pee?
No.
Everything normal?
Yes.
That's the patient. I am assessing on bare skin. The patient's skin looks very nice and normal. No signs of lesions, marks, everything is normal. Now I'm going to auscultate the patient's sounds, starting in the right lower quadrant. Right lower quadrant. Right upper quadrant. Right. If there were no bowel sounds, I would listen for 5 minutes in each quadrant. I'm also going to check, percuss the patient. Now I'm going to palpate the patient. Let me know if you feel any pain. All right, no pain? Thank you. That concludes the abdomen section. Now I'm going to go to the lower portion of your legs, your lower extremities. Skin looks nice and normal. No signs of edema, no pitting, no lesions, no marks. Patient does not have sparse hairs on the skin. Everything looks normal. Now could you flex your feet up to your nose? Could you press the gas pedal? Could you push your right leg out, left leg out, knee to chest, knee to chest. Thank you. I'm testing the capillary refill Everything looks nice and normal, less than 2%. And I'm going to assess your dorsal pulse, your tibial pulse. All right. Could you pull your feet heel to shin? Could you do it on the other leg? Thank you. Now I'm going to do your deep tendon. Could you let your legs rest, please? All right. All right, we do have a reflex. Everything looks pretty normal and space. This concludes our head to toe assessment. Conclude.